welcome back. Joining us from the Community Dental Clinic is Dr. Brandon Taylor, who is the clinic director and also the dentist, and also Kim Taylor, who is the patient advocate. Welcome both of you to the show.
Thank you very much.
Thank you.
Appreciate you guys stopping by. The first thing, Brandon, I'm going to direct this at you, if I could. Share with our viewers just the general mission and purpose of the Community Dental Clinic.
Okay, well, the Community Dental Clinic was started in 2009, really due to an outpouring of just concern over the oral health needs of our community. Trips to the emergency department at our hospital were very high for dental-related needs. Teachers and school administrators were noting that children had obvious decay, showing up to school with swelling, missing school days. And then people who work with people who have suffered from substance abuse really felt like there was just no outlet for those sort of patients. So at the Community Dental Clinic, we strive to give everyone an opportunity at a healthy smile. We focus on treating those populations that are really underserved, like Medicaid or low-income families with no dental insurance.
Well, you know, it's interesting when you told me the information when you sent it to me and gave me the example of, and I want you to give this example of the of what Medicare pays for a tooth extraction.
Right.
It was like a dentist is going to charge you anywhere from $200 to $500.
Right, absolutely.
And is it Medicaid is only going to pay like
about
34,
10%, about
yeah,
$34.
$34.
Yeah.
Well,
yeah, really unsustainable.
yeah, I mean, what are people to do? And because we know that a tooth gone non-attended gets infected, and that can cause a whole series of other problems, can it not?
Absolutely. Absolutely.
Okay, all right. Kim, what is your service area? In other words, what counties do you actually serve and the approximate number of people who actually qualify?
Well, our primary focus is the Green River District, which includes Davis County, Henderson, Hancock, Ohio, McLean.
That's a lot of...
Union and Webster.
Union and Webster, yeah.
But we also focus on a case-by-case basis, Butler, Muhlenberg, Hopkins, Breckenridge, and Grayson counties.
Okay.
And so the population of Medicaid patients in Davis County alone for adults and children is over 26,000 people.
Wow.
In our region, it's 97,000 people.
Okay.
And that doesn't even include the number of patients that don't qualify for Medicaid and don't have dental insurance.
I see.
So you can see that it is an overwhelming task that we have just for 2 dentists and 1 hygienist and staff to try to overcome.
So just that office there alone handles all those
We're really
counties.
On any given day, if you were to look for a dentist in the city of Owensboro that accepts Medicaid, you may only find 2 to 3 offices that, based upon your age, that would even accept a new patient. And so, while we're not responsible for every single last one of those patients, we are responsible for the overwhelming majority.
Yeah. Well, especially what's really concerning, Kim, and I'm sure you can relate to this, is the children.
Yes.
You know, they can't get, if their parents can't afford, you know, dental, whether it's dental insurance or dental care, that's not a good way to start out.
Exactly.
For the kids. So, well, Brandon, what kind of treatments do you provide?
Well, our patients range in age from 5 to 105, and so it's really our goal to be the dental home for every individual, every family, and we want to change the way they view going to the dentist. We want to change the way they view their own smile, and so we approach it in a comprehensive way. We offer preventative care, fillings, extractions, and then on a case-by-case basis, we'll do some expanded services like root canals and crowns.
Okay. Now, is that because of a limited amount of equipment, or what?
Well, really, Medicaid reimbursement. Medicaid does allow for a few more services to be done on children. It's very, very limited on adults, but really in the state of Kentucky, we're blessed to have an adult dental benefit at all. There's many states that do not have a dental benefit at all for Medicaid patients.
Oh, wow. Okay. Brandon, also, I understand that you're very involved in school dental screenings.
Yes, and really since the Community Dental Clinic opened in 2009, in one form or another, the clinic has provided some sort of in-school free dental screenings. But this program has really expanded, exploded in the last couple of years. Just this past fall, we offered to every county and city elementary school, we offered to come in and screen every child at that school. Now, only 15 of those schools took us up on the offer, and we are dependent upon the parents returning the consent forms. But we were able to screen 41% of those kids. That's a little over 3,000 children that we screened. And we see everything from perfect, wonderful teeth to swelling that's in the child's face, and the child's going to school, and it's really, really dangerous. So a little bit of everything we see.
Okay, because I know the Goodfellows Club here locally. They also, I know we did we've interviewed them several times, and I know
Absolutely.
sometimes they take care of some dental issues.
They've been a great partner for us, and that's really what sets the community dental clinic apart from some other in-school programs that have kind of come and gone. We're not just going to come into the school and identify needs. We're going to offer to take care of those needs. So every child that's screened goes home with the results of their screening, as well as our pamphlet, the information, so the family can contact us. So we want to take care of what they need.
Okay. Well, listen, I know you guys just, you're very busy providing services, just, not just in your office, but you're very active with partnerships out into the community. Why don't you share some of those with us?
Well, we know that we can't do it by ourselves, and we know that collaboration really yields the best results. So I don't want to forget anybody, but just to name a few of the organizations we work with: Owensboro Health, the Green River Health Department, Mary Kendall, Wendell Foster, River Valley Behavioral Health, Dismas, Oasis, and Owensboro Regional Recovery are some of the organizations we work with. And several of those were involved substance abuse, and we really feel that dentistry is an integral part of the healing process for anyone who suffered from addiction. We help reduce their pain, help maintain their sobriety so they're not having to take pain meds,
Right.
And then really improve their smile so they have a better chance at landing a good job.
Right. Well, you had said something in the notes that you'd sent me, and it was very interesting. Matter of fact, I went over and shared with some of my employees. 3 out of 5 people who go to the ER
At the University of Kentucky and
Right.
University of Louisville,
it's a dental
related issue.
It's a dental related issue.
Yes.
What does a hospital do at the? I would never have thought that. I would never have thought that someone would go to the ER because they got a toothache. I just wouldn't think that. What would the hospital do for somebody like that? They're certainly not going to pull a tooth.
Right.
Well, just like if someone showed up to our office with a broken arm, we could maybe look at their arm and say, well, it may be broken. So the hospital does the best they can to assess the situation. And really in the past, all they were able to do was maybe give a pain prescription and an antibiotic and tell the person you need to see a dentist.
Right.
And that has been a huge partnership between us and Owensboro Health. Just the fact that now they can direct that patient toward us to help take care of that. It's really cut back. There's a huge movement to restrict the amount of narcotics that are going out into our community. And so they've been able to limit the amount of narcotics that they're writing for dental-related issues that they can address. Kim, you have a statistic for the amount of billing that was in the state of Kentucky. Was it something like $9 million for dental-related issues?
Yes, that was just for emergency room visits.
Wow.
And I did the math for it, and if you take, it was over 19,000 Kentuckians who went to the emergency room, and it was over $9 million worth of treatment that was sent to Medicaid. If those same 19,000 people had come to our office
Or any dental office.
or any dental office, we would have only been reimbursed $18.90 for that visit.
Wow.
Per patient.
Yeah.
So that's a huge difference. So we definitely want people to go to a dentist instead of going to the emergency room, because your issue is not going to be taken care of at the emergency room anyway.
Exactly. Unless you're just, because all they're going to do basically is probably give you something to take the pain away. But unfortunately, that can be a narcotic. And we know if you do have people who are recovering and things of that nature, that can be an issue also.
Now, there are some issues, some cases where someone is so far gone that they do have to be admitted to the hospital. They're at risk of dying from a dental infection.
Yes.
So, so those cases can, but the sad thing is that person may have just not had an opportunity to go to a dentist, and it got to that point very quickly.
Well, I'll say one thing. When you talk about different pains that we experience in our lives, dental pain
can't be ignored.
Your world stops.
Yes.
You may not be able to eat. You may not be able to sleep. I mean, there's a few things like that in our lives where it's like with dental pain, it's like everything's got to stop at this point until I get this fixed.
Right.
So I can only imagine what it must be like if you don't have the resources to take care of that. Kim, I want you to tell us about an upcoming event this April called Kentucky Oral Health Regional Summit.
Yes, we are on April 29th. We are going to partner with the Kentucky Oral Health Coalition. We are holding the first ever Kentucky Oral Health Regional Summit at Owensboro Health Regional Hospital. They have very graciously provided the venue for us at no cost. And we're basically trying to bring together a very diverse population to address the dental access issues in our community. We are encouraging everyone from local policymakers, dentists, hygienists, physicians, substance abuse facilitators, educators, anyone that has any interest in furthering this cause, we are inviting them to come to. And anyone can learn more information at the KY Oral Health Coalition .org website, and they can sign up for that event.
Okay. So is the goal here, because you have to educate me on this, is the goal to have more clinics such as yourself open up, or?
Not necessarily more clinics like ours, but to possibly get more of the 57 dentists that are already operating in our area to possibly consider taking on Medicaid patients.
I see.
Because just 2 or 3 dentists in this area alone is not going to make a dent in the 26,000 Medicaid patients that we have just in Davis County.
Yeah. Again, when is that summit coming up?
It's on April the 29th.
Okay.
It's going to start at 9 a.m.
Okay.
And attendance is limited to 125 people.
Oh,
so,
okay.
yeah.
All right, excellent. Kim, real quick, how is the clinic where you're at, how is it funded?
Well, there is 0 funding from state or federal organizations.
Okay.
We receive 0 financial support from any universities. We are entirely funded upon non-sustaining Medicaid reimbursements and the generous donations of local organizations and individuals.
Okay.
So if it weren't for the help of, just for example, this past year, we had grants and donations from Owensboro Health, Good Samaritans, United Way, the Michael Horn Foundation, Davis County Physical Court, the Women's Guild, and Yeager Trust. And if it weren't for those individuals supplying some of the financial needs, then our doors wouldn't be open.
Okay. So you take individual donations too, private donations.
Yes.
How can people go about giving some support?
They can make, like we said, a financial donation. They can always send checks made out to the community dental clinic.
Okay.
This is, a tax benefit for individuals. We also like to have people support us politically and just
be advocates for it.
Yes,
Absolutely.
exactly. Yeah. Pass the word on about the Regional Health Summit.
Right.
We need people to go out and tell their dentists, hey, I've heard about this. How about you guys sign up for it too and see what it's all about?
Well, excellent. Well, listen, share with our viewers, Kim, how can they get additional information about the clinic? You got some social media sites out there.
Yes, they can look at our Facebook account, and also our website is owensborodentalclinic.com.
Very good website, and also like your Facebook page. Good job.
Thank you.
You guys are doing a great job. Well, listen, thanks for stopping by.
Thank you so much.
I appreciate you guys coming by and sharing with us your mission and so forth, and what you're doing is great work. So congratulations.
Thank
again.
you. Thank you for having us.
Thanks for tuning in to this segment of 71 Magazine. We'll see you right back here in March.